Hello everyone, this is Dr. Pratima Gurung and I'm back again with another video, and in this video I'll be talking about trigeminal nerve and its branches. The trigeminal nerve is one of the cranial nerve. It's the fifth cranial nerve and very important for dentistry. The trigeminal nerve leaves the cranium or the brain, and it divides into ophthalmic branch, maxillary branch, and the mandibular branch. The ophthalmic, it goes towards the reason eye area, so that is not important for us. So let's focus on the other two. The maxillary nerve is one of the important branch, and as the name says, maxillary, so it will be supplying the areas and the teeth around the maxilla. So the maxillary nerve again divides into 5 branches. So here we can see the 3 of them. The first is the anterior superior alveolar nerve, which supplies the anterior teeth, hence the name is given anterior. Superior means the upper because it's supplying the maxilla or maxillary area. So anterior superior alveolar nerve, which is supplying central incisor, lateral incisor, and canine. And then we have middle superior alveolar nerve, which is supplying first premolar, second premolar, and the first molar, but the mesial half of the first molar. And we know that the first molar has 3 root: the mesial root, the palatal root, and the distal root. So the up to the mesial root or the mesial half is supplied by the middle superior alveolar nerve. The posterior superior alveolar nerve supplies the upper first molar, second molar, and the third molar. Again, just remember the distal half, not whole of the first molar. Yeah, so that is the posterior superior alveolar nerve. So where are the other 2 branches? So that was the 3. Now we know there is 5 branches. So the other 2 will be supplying inside of the mouth towards the palate, or we also call roof of the mouth. So the in the palate there is a greater palatine nerve, which is a branch of the maxillary nerve that is supplying all the posterior teeth and the middle teeth, and up to the distal half of the canine also is supplied by the greater palatine nerve, yeah, which is emerging out of the greater palatine foramen. And another branch, which is called nasopalatine nerve, will emerge out from this foramen, which is called nasopalatine foramen or incisive foramen. So the nerve coming out, the nasopalatine nerve, has 5 branches again, which is supplying central incisor, lateral incisor, and canine. Again, not whole of the canine, but up to the major half of the canine. But here, the things to remember is not the actual tooth it will supply, but it will supply the gingiva of this teeth, the palatal gingiva, yeah, of this teeth. So that's all about the maxillary nerve. Now let's come back to the first diagram. So the mandibular nerve emerges out of the foramen oval, yeah, from the skull, from the base of the skull, and then it divides into 4 important branches. The first will go towards the muscles of the mastication, like masseter, temporalis, lateral pterygoid, and medial pterygoid, and helps in their movement. So that means that is a motor branch. And the other important branch, lingual branch, which will be going towards the tongue and supplying the anterior 2/3 of the tongue for the taste sensation. And long buccal nerve, another branch, the long buccal nerve will supply the 3rd molar, the 2nd molar, and the 1st molar, but only the buccal gingiva, yeah, buccal, not the tooth, actual tooth itself. So that is the long buccal nerve. The last nerve, which is the main important nerve, that is the inferior alveolar nerve, which enters from the mandibular foramen, goes into the mandible, and then runs across the mandible, supplying all teeth in the mandible. So the actual teeth, it is supplied by the inferior alveolar nerve, plus it also supplies the buccal or the labial gingiva from the premolar to premolar. Yeah, so again, please don't confuse with this inferior alveolar nerve. The inferior alveolar nerve will supply all the teeth, the actual teeth, not, we are not talking about gingiva, all actual teeth, and the buccal or the labial gingiva from premolar to premolar. But however, as we saw, the long buccal nerve supplies the buccal gingiva of the molars. Yeah. that's all about the trigeminal nerve and its important branches. If you have any question, please leave in the comment, and I will try to make another video explaining your queries and confusions. If you want to know about other nerves, which will be facial nerve, glossopharyngeal nerve, and hypoglossal nerve, these three nerves are also important for dentistry or for the dental nurses. So if you would like a video about these nerves, please also write it in the comment, and I will make another video. Thank you for today. Good luck. Bye bye.